The first recording begins with a sound that does not seem human. It is not a scream. It is not a cry. It is something deeper, a torn, grinding noise, like a voice being forced through a throat that does not want to release it. The tape hisses, the room echoes, and then a priest quietly says a name, asking if the person inside the body can still hear him. For several seconds, there is only breathing. Wet. Uneven. Strained. Then a reply comes, layered, distorted, almost doubled, answering in a tone that no medical report could explain. According to church records, that recording was made in Germany in the mid-1970s. It would later be played in courtrooms, examined by psychiatrists, and debated by theologians. It was part of a case that did not remain inside a church. It reached the legal system and forced authorities to change how exorcisms were viewed under the law. The young woman at the center of the recordings was not found in a remote monastery or hidden cult. She came from an ordinary, deeply religious household. Her teachers described her as quiet. Her neighbors described her as polite. Her early medical files described her as healthy. Until the fainting began. Witnesses later reported that the first collapse happened at school. There was no warning. She stiffened, fell sideways, and began to tremble. Her eyes remained open but unfocused. A classmate thought she was choking. Another believed she was having a seizure. By the time help arrived, the episode had ended, leaving her confused and exhausted. Doctors initially suspected a neurological disorder. Tests were ordered. Brain scans were taken. Medication was prescribed. For a short time, the treatment seemed to help. Then the sound started. Her mother would later testify that at night, she began hearing knocking from inside her daughter's bedroom. Not on the door, but from the walls and floor. Slow, deliberate taps, like someone signaling from behind the structure itself. When she opened the door, the girl would be sitting upright in bed, eyes open, staring at nothing, her lips moving in a whisper too faint to understand. Medical notes describe these early changes as behavioral disturbances associated with seizure disorder. But the family insisted something else was wrong. The girl reported a heavy pressure on her chest when she tried to pray. She said sacred images made her feel sick. She began smelling something foul that no one else could detect, a rotting odor like burned fabric and spoiled meat. She complained that it followed her from room to room. Multiple witnesses confirmed that she repeatedly checked the house for a source of the smell. Nothing was ever found. According to later interviews, she told her parents that when she closed her eyes, she saw faces. Not dreams, faces watching her from very close distances. She described them as patient and expressionless. Her medication dosage was increased. The seizures did not stop. Instead, they changed. A neurologist wrote that the episodes began lasting longer and were accompanied by vocalizations, low growls, muttering, and sudden bursts of shouting. During one hospital stay, a nurse reported that the patient refused to step into a room where a small cross hung on the wall. She became agitated, breathing rapidly, and had to be physically guided inside. The incident was logged as religious anxiety reaction. At home, the situation grew worse. Furniture was found shifted. Religious pictures were turned backward. On several mornings, the girl was discovered sleeping on the floor under the table, curled tightly, as if hiding. She claimed she did not remember moving there. Her parents sought additional medical opinions. Different specialists reviewed the scans. A second hospital confirmed a seizure-related diagnosis and adjusted her treatment again. Sedatives were added. Stronger anticonvulsants followed. Nothing stabilized her condition. Neighbors later stated that they began hearing strange noises at night, heavy thuds, dragging sounds, and repeated rhythmic impacts like stomping. One neighbor described hearing a voice through the walls speaking rapidly in a tone that did not resemble normal conversation. He assumed the family was playing recordings. They were not. According to church correspondence from that year, the family first contacted a local priest after the girl refused to enter the church building during Sunday service. She reportedly froze at the entrance and could not cross the threshold. 2 relatives attempted to lead her inside. She became rigid and began screaming, not words, just raw sound, until they brought her back outside. The priest initially suspected psychological distress combined with strict religious upbringing. He recommended counseling and continued medical care, but the reports kept coming. She claimed that unseen hands were touching her arms and legs while she lay in bed. She said she heard voices arguing near her ears at night, not commanding, but discussing her. When asked what they said, she answered, "They are deciding when." Medical staff recorded auditory hallucinations. During one examination, she suddenly spoke in a tone described by a witness as not matching her age or personality. The attending doctor wrote that her voice dropped in pitch and became harsh, almost mechanical. The episode lasted less than a minute. When it ended, she seemed confused and asked why everyone looked frightened. The doctor attributed it to a dissociative episode triggered by neurological stress. But the family noticed a pattern the reports did not emphasize. The disturbances intensified around religious objects and prayer. Her mother later stated that the girl could no longer tolerate blessed candles being lit nearby. She covered her ears during prayer and shouted for it to stop. Once, during a quiet afternoon, she was found in the kitchen attempting to scrub her hands repeatedly with scalding water. When asked why, she said they were not her hands. According to a written statement from a visiting clergyman, the first private blessing was attempted in the home months before any formal rite was approved. The priest read quietly. The girl at first seemed calm. Then she began laughing, slowly, rhythmically, without smiling. The priest stopped the prayer midway. He later wrote that the sound disturbed him enough that he did not finish the text. Medical authorities were still firmly involved. Adjustments to treatment continued. The diagnosis remained neurological with psychiatric complications. There was no official recognition of possession. No church authority had approved any ritual. But documentation shows that more clergy were consulted. One priest wrote in a private letter that the case showed an aversion pattern specifically tied to sacred symbols to ignore. He did not claim possession. He did not deny illness. He wrote that something about the reactions felt deliberate rather than symptomatic. The girl's physical condition began to deteriorate. Witnesses reported sudden bursts of abnormal strength. She reportedly pushed a heavy wooden chair across the room with one arm during an episode. She began performing repetitive physical actions for hours, kneeling, standing, kneeling again, until her joints swelled and bruised. Her voice changed more often now. Recordings made by the family captured segments of speech that sounded strained and layered, as if two tones emerged at once. Audio experts years later argued that stress and throat damage could produce similar effects. Others disagreed. Church authorities required strict verification before approving any formal exorcism. Multiple interviews were conducted. The girl was questioned repeatedly about her experiences. She described feeling crowded inside and said prayers sounded distant, as if heard through thick walls. One investigator noted a chilling detail. When asked to repeat a short blessing phrase, she could not complete it. She tried several times. Each time she stopped at the same word and began shaking. The file included a line underlined twice. Subject shows extreme resistance to sacred recitation beyond expected psychological response. Months passed before permission was granted for a limited rite. By then, according to testimony, the household atmosphere had changed completely. Curtains remained closed. Visitors were rare. The sounds at night had grown louder. Impacts, growls, repeated knocking from inside the bedroom walls. The first authorized ritual was conducted quietly, with only a few people present. A tape recorder was placed on the table. The priest began reading. For several minutes, nothing happened. Then the breathing started again. Heavy, uneven, exactly like the sound that would later open the most widely known recording. A witness wrote that the temperature in the room felt noticeably colder, though no window was open. Halfway through the reading, the girl lifted her head and stared directly at the priest with an expression he later described as alert and hostile, but not her own. When he addressed her by name, she did not respond. When he commanded whatever afflicted her to identify itself, the reply came instantly. Not in her normal voice. Not in a whisper. but in a tone that made the assistant priest reach forward and switch off the recorder because he believed at that moment it was malfunctioning. It was not malfunctioning. And when the tape was played back later, the room realized the machine had captured every word. The playback revealed something none of them expected. The priest's question was clear on the tape.
Come.
Formal. Directed. The answer was not. The voice that responded did not match the young woman's known speech pattern. It came out compressed and rough, with a strange dragging resonance, as if forced through clenched teeth and a damaged throat. Audio specialists years later would argue about distortion, microphone overload, and vocal strain. But the men in the room that night were not thinking about acoustics. They were thinking about the words. Because the reply did not give a personal name. It gave a denial. According to the assistant priest's written statement, the voice answered, "She is not here," followed by a sound like a low animal growl sustained longer than a human exhale should allow. The ritual was stopped early. Church procedure required caution. One session was not enough to confirm anything. The supervising clergy ordered continued medical oversight and limited further blessings rather than a full exorcism rite. Documentation shows that the case remained in a gray zone, not dismissed, but not formally declared possession. But the events inside the house did not slow. Witnesses later reported that her sleep nearly vanished. She stayed awake for long stretches, pacing or sitting upright, eyes open, breathing through her mouth. When she did sleep, it lasted minutes, not hours. She complained of being shaken awake by invisible hands. More than once, her parents found her on the floor beside the bed, claiming she had been pulled down. Bruises began appearing along her arms and ribs. Doctors attributed them to seizures and falls. The family insisted some marks appeared overnight without any known injury. Food became another problem. She refused meals, saying the taste had changed. She described ordinary bread as bitter and water as foul. Medical records show rapid weight loss during this period. Supplements were prescribed. She sometimes accepted them, sometimes spat them out immediately, gagging violently. A nurse who visited the home wrote that during one feeding attempt, the girls stared at the wall behind the nurse's shoulder and whispered, "It is standing there again." The nurse turned. Nothing was present. When she looked back, the girl was smiling faintly, not with relief, but with recognition. Another tape session was scheduled under church observation. This time, 2 recorders were used. The priest followed a stricter formula. Latin passages were read slowly. Questions were directed clearly. Commands were repeated 3 times each, as protocol required. For the first 10 minutes, the girl remained motionless except for shallow breathing. Then her fingers began to flex slowly, rhythmically, as if counting. When holy water was sprinkled lightly across her forehead, her eyes opened with sudden intensity. Witnesses later agreed on this detail. She did not blink for an unusually long time. The priest asked again who was speaking. The answer came layered, a primary voice with a second tone vibrating beneath it, slightly delayed, like an echo that spoke at the same time instead of after. The assistant priest dropped his pen. On the tape, you can hear it strike the floor. Medical reviewers later suggested that throat spasms and forced vocalization can produce multiphonic sound. But even they noted that the timing pattern on the recording was irregular. The responses became more hostile. When commanded to be silent, the voice laughed. Not loudly, but steadily, without breath breaks. The laugh lasted almost 20 seconds. The supervising clergy halted the session again. Internal church correspondence from that week shows a shift in tone. Earlier notes were cautious and medical. Later ones included phrases like persistent intelligence behind responses and resistance beyond symptomatic reaction. Permission was requested for a formal, repeated exorcism sequence. Approval did not come immediately. Meanwhile, her condition worsened. Neighbors described new sounds, heavy impacts against the bedroom floor late at night, followed by dragging movements. One neighbor claimed a picture frame fell from their shared wall at the exact moment a violent thud sounded next door. No structural cause was found. The girl's posture began to change during episodes. Witnesses described her body stiffening into unnatural angles for short periods, chin pulled down, shoulders raised, fingers curled inward tightly. A visiting doctor wrote that the tension resembled severe seizure lock, but noted that she sometimes spoke clearly while maintaining the posture, which was medically unusual. Her speech content also shifted. She began making statements about people she had never met, naming distant relatives, describing clothing they were wearing that day. In later testimony, 2 such details were confirmed accurate. Skeptics argued coincidence and prior exposure through conversation. Supporters argued otherwise. The family priest documented a chilling exchange during a private visit. He asked her silently, without speaking aloud, to recite a short internal prayer with him. Before he finished thinking it, she reportedly said, "Stop that," and turned her head away sharply. He wrote only one line beneath the entry: "I did not move my lips." Medical supervision continued throughout this period. Adjustments were made again to medication. Stronger sedatives were introduced. The seizures decreased slightly, but the vocal episodes and aversion reactions intensified. She stopped entering rooms where religious images were visible. Family members removed several items to reduce her distress. The effect did not help. She began reacting even when the objects were covered or placed in drawers. According to sworn statements, she once identified the exact drawer where a small cross had been hidden without being told it was there. The bishop overseeing the region reviewed the case personally. His written authorization allowed a formal exorcism under strict conditions, continued medical involvement, detailed documentation, and recorded sessions. 2 priests were assigned. Both had prior pastoral experience but limited direct exorcism work. They accepted reluctantly, according to their later testimony. The first official rite lasted nearly an hour. The tape begins quietly. Pages turning. Breath. The priest's voice steady but tense. The questions are ritualized, controlled. The responses are immediate and aggressive. Multiple voices appear across the recording, some higher, some lower, often overlapping. Linguistic analysts later suggested extreme vocal strain plus deliberate pitch manipulation. Others said the transitions were too rapid to be consciously performed by a weakened patient. At one point, the voice identifies itself with a historical name not previously mentioned in the room. The pronunciation is archaic. A scholar consulted during the later investigation confirmed the accent matched an older regional dialect rarely used in modern speech. Skeptics argued exposure through books or prior study. Family members insisted she had never encountered the term. During the 4th recorded session, a new behavior emerged. She refused to sit or lie on the bed. Instead, she remained crouched on the floor for nearly the entire ritual, head tilted upward at an uncomfortable angle, eyes tracking movements that others could not see. When commanded to look at the cross held before her, she shut her eyes tightly and began speaking rapidly in fragmented phrases. The assistant priest attempted to touch her shoulder. She reacted with explosive force, not striking him, but throwing her upper body backward with such violence that 2 people moved to steady her. Despite her malnourished state, the force surprised everyone present. Medical reviewers later attributed this to seizure adrenaline response. The priests wrote a different description: strength disproportionate to physical condition. The sessions continued across weeks. Her body weakened further. Knees became inflamed from repeated kneeling motions she performed compulsively, sometimes hundreds of times in a single day, witnesses said. Her voice grew hoarse between sessions, yet during the rites it regained intensity. Recordings captured moments where she answered questions before they were fully spoken, interrupting with defiant replies. Timing analysis years later showed several overlaps measured in fractions of a second. Debate continues over whether anticipation or coincidence explains it. Then came the session that changed the legal outcome of the entire case. The ritual began like the others, controlled, documented, tense, but procedural. Halfway through, the supervising priest shifted from questioning to direct command language reserved for advanced stages of the rite. The reaction was immediate and violent. The tape records a deep, continuous roar that does not resemble earlier vocalizations. Furniture is heard scraping across the floor. Someone shouts for assistance. The priest continues reading over the noise without stopping. When asked again for identification, the voice answers with multiple names in sequence, not shouted, but declared with cold precision. One of the assistants began crying quietly. The microphone captured it. Afterward, according to testimony, the girl collapsed into near unconsciousness and did not respond to her name for several minutes. Her pulse was rapid but weak. A doctor present insisted the sessions be reduced in length due to physical danger. But the rites did not stop. Because by then, everyone involved believed they were no longer dealing with a purely medical case. And the recordings were no longer private. Copies had begun to circulate beyond the church offices. One reached a legal authority who did not expect to hear what was on it. And once it was heard, the question was no longer only spiritual. It became criminal. The official investigation did not begin with belief. It began with suspicion. When the recordings reached legal authorities, the first assumption was not possession, it was negligence. A young woman was visibly deteriorating. Multiple religious figures were conducting repeated rituals. Questions were raised about medical oversight, coercion, and physical risk. According to court summaries, prosecutors first listened to selected portions of the tapes in a controlled setting. Several expected exaggeration or staged behavior. Instead, they heard long stretches of structured ritual dialogue interrupted by sounds that were difficult to classify, animalistic vocal tones, abrupt shifts in voice character, and violent physical disturbances captured by the microphone. One investigator later stated that what unsettled him most was not the screaming, it was the moments of calm in between, when the answering voice spoke slowly, clearly, and with deliberate contempt. Medical experts were consulted again. Neurologists confirmed that seizure disorders and certain psychiatric conditions can produce altered vocalization, dissociation, and religious fixation. But they also noted something troubling in the timeline. The patient's physical decline accelerated during the final months despite continuous treatment attempts. Weight loss became extreme. Muscle damage was documented. Her knees showed thickened bruising and deep inflammation from repeated impact with hard surfaces. Witnesses stated she performed hundreds of kneeling motions daily, often without being instructed to do so, sometimes continuing until she collapsed. Photographs taken from medical records show a progression from a healthy young woman to a figure nearly unrecognizable, gaunt face, hollow eyes, visible bone structure beneath the skin. Yet the rituals continued. The priests involved later testified that they attempted to pause sessions several times due to her condition. According to their statements, she reacted with panic when delays were proposed, insisting the rites must continue, claiming the presence inside her grew louder when they stopped. One priest recorded a private note after a late-night session. When we paused, the hostility increased. Not her distress, something else. Directed. Focused. Patient. The final phase of the rites extended over many months, with dozens of recorded sessions. Church documents confirm that special permission was granted for repeated exorcism attempts, an uncommon approval at the time, requiring high-level authorization. During the later recordings, the voices grew weaker in volume but sharper in tone. Analysts noted that although her physical strength was fading, the verbal responses became more structured, more articulate, and more openly defiant. Several tapes include moments where the priest reads a sacred text and the responding voice begins speaking over it, not randomly, but targeting specific phrases with interruption, mockery, or direct contradiction. A linguistics reviewer later testified that the interruptions were semantically precise. They did not occur at random points in the sentences, but at meaningful theological statements. Skeptics argued pattern recognition bias. Believers argued intention. Near the end, the sessions moved to a stricter format. Fewer people were allowed inside. Windows were covered. The tape recorder remained the only constant witness besides the clergy and immediate family. One of the last complete recordings begins with silence lasting nearly 2 minutes. No one speaks. The priest later explained that they waited because the atmosphere in the room felt oppressively charged, and he wanted everyone calm before beginning. On tape, you can hear only breathing and an occasional floor creak. Then the rite starts. The responses are immediate. The voice sounds shredded now, throat damaged, strained, yet still carrying the same layered quality heard months earlier. At one point, the priest asks if the entity understands it is commanded to leave. The reply comes in a near whisper. She is almost finished. Medical experts later interpreted this as the patient referring to her own exhaustion. The priests interpreted it differently. By this stage, her ability to eat had nearly vanished. Reports confirmed she rejected most food and fluids. Attempts to feed her were often met with gagging or refusal. Whether from psychological aversion, neurological disruption, or religious fixation remains disputed. Her body temperature fluctuated unpredictably. Sleep was nearly non-existent. Witnesses described a constant smell in the room, sour and decayed, though no medical source was identified. Investigators later searched for environmental causes and found none documented. During the final recorded rite, a detail appears that is still debated. Halfway through the session, the priest commands silence and asks a question in Latin that is not part of the standard formula, an improvised line, according to his later testimony. He asks why the suffering has been prolonged. The answer comes immediately, in German, not Latin. Because she was offered. There is a long pause on the tape. No one in the room responds for several seconds. In court, this line became one of the most argued segments. Critics said it reflected the patient's internal religious guilt and sacrificial thinking. Supporters said the timing, answering an unscripted Latin question instantly in another language, suggested an external intelligence. No conclusion satisfied everyone. The final days are documented with painful clarity. Medical records show severe malnutrition, weak pulse, advanced physical collapse. Clergy notes show urgency, multiple rites performed close together, prayers extended, commands repeated with greater intensity. Then the recordings stop, not because the case ended, but because she no longer had the strength to continue. She died in the summer of 1976. The official cause of death was listed as complications from malnutrition and dehydration. She was 23 years old. What followed moved beyond church walls. A criminal trial was opened. The parents and the two priests were charged with negligent homicide. The prosecution argued that medical care should have overridden ritual practice. The defense argued that medical treatment had been continuous and unsuccessful, and that the exorcism was performed with legal church authorization and the patient's repeated consent. The courtroom heard the tapes. Segments were played aloud. Observers reported that the atmosphere inside the court changed when the recordings began, not emotionally, but physically quiet. Even those skeptical of possession described discomfort hearing the vocalizations echo in a legal chamber rather than a chapel. Expert witnesses disagreed sharply. Psychiatrists described temporal lobe epilepsy, psychosis, religious delusion, and dissociative identity phenomena. Theologians described classic possession markers, aversion to sacred objects, hidden knowledge, vocal transformation, and ritual resistance. The judge did not rule on the supernatural. The law could not. Instead, the ruling focused on duty of care. The court found the defendants guilty of negligent homicide but issued reduced sentences, citing shared responsibility, medical complexity, and sincere belief in the necessity of the rites. According to legal historians, the case directly influenced how German authorities structured oversight on extreme religious interventions afterward. New guidelines emerged regarding medical priority and spiritual treatment boundaries. The law changed because of what happened in that bedroom. The tapes were archived. For years, only fragments circulated privately. Researchers, clergy, and legal scholars requested access. Some were granted partial review under supervision. Many who listened wrote similar notes. Not all believed in possession, but most agreed the recordings were deeply disturbing. One audio technician wrote, "I expected theatrics. I heard exhaustion, hatred, and something that sounded like it did not want to be recorded." The house where the rites occurred remained standing for some time. Visitors occasionally came, often uninvited. Neighbors reported people lingering outside at night, sometimes leaving candles, sometimes trying to provoke a reaction from an empty building. Nothing officially documented ever occurred there again. But one detail remains in the church file that investigators could not categorize. In the final written report from the supervising priest, added after the trial concluded, there is a closing line written in careful handwriting. During the last session, when asked her name softly, she answered correctly. Once, in her own voice. It was the only time in months. She sounded relieved. No tape exists of that moment. The recorder, according to the log, had run out of tape less than a minute earlier. And the room, for the first time since the rites began, was completely silent.